In patients with aortic stenosis, which is a tightening of the aortic valve of the heart, the treatment used to be only surgical in nature. Over the last 10 years, we've progressively gotten better and better at using percutaneous options where we go in through the groin just to replace the valve from a lesser invasive standpoint. What we do for the procedure is we get access in both femoral arteries in the groin. We go up with catheters and wires all the way up to the heart valve, the aortic valve itself. We cross over into the heart. We put a balloon up across the aortic valve to help open up the valve and loosen it up. Through the wire, we use the wire sort of like a railing, like a railroad track, if you will. Over the wire, we go up with the TAVR valve itself. So we pace the heart so that the valve doesn't move as we deploy it into place. And we go up with a balloon to put the valve in place. We don't remove the old valve, we don't remove the native valve. It stays there, but it's out of the way. It's behind the new valve. It allows adequate blood flow to be coming out of the heart immediately. So it's akin to if you had a hose and you had your thumb over the hose, and we go into our procedure and all of a sudden your thumb's out of the way. It allows for adequate flow and patients feel better immediately. So with open heart surgery, patients have to go into the hospital. They have to get a big procedure, a big open heart surgery. They have the recovery time from that, not only in the hospital, in the ICU with chest tubes and a ventilator, but also the physical therapy recovery. Studies have shown it takes about 6 months to recover fully to get back to normal from those procedures. Through the TAVR procedure, patients usually go home the next day.